Welcome everybody. We're going to look at the most frequently requested paediatric products. Hopefully you've got your poster. This is a Sling selector poster that details all the products on our website. And we've tried to put them into families. Line 9 are the most popular requested paediatric products, and we'll cover as many as we can of those. But this is quite helpful to use as a reference, and certainly if you select something, then you can look at the website for more information, and it will give you all the information, data sheets, instructions, little fitting videos, etc. So at a glance poster, if you haven't got it, we'll make sure you've got it later on. So looking at the slings, we're going to cover some manual products, some harnesses, and a couple of slings. So to start with, we've got a little manual jacket. So in paediatrics, there's lots of different options, many different scenarios. We're not moving and handling advisors. Basically, we're product specialists. We're going to be showing you the products in the hope that you can transfer that information to some of your scenarios. So looking at the walk assist, I think Alice, if you can just kindly bring up the information on the website so you can see the detail that we've got for the products, and this will give you an example if we look at the first one. So the walk assist jacket, it's a little lightweight jacket that wears like a waist jacket, basically a waistcoat. It's lightweight. It's been designed so that for ambulant people, for children, adults, and it's there to help steady. So it's basically so that the carer doesn't have to grab them, clothing, arms, etc. There's little handles positions so that it can be used to steady and give postural support in that way. So if we just scroll down to, you can see the layout of the website there. There is a data sheet with all the information on, a little sizing guide there to help you with sizing and measurements of the product. So this sort of information is available for every product that's on the website. Thanks, Alice. We'll come back and I'll just show you this little harness. It's a lightweight mesh, which just goes on like a jacket and zips up fully from the bottom. Judith's kindly arranged to be my model today. So we can see here, fits like a jacket. We've got positioning handles to the sides there and on the hip. And there is a little zip both sides as an expander. So if they're wearing outer clothing, then we can undo the zip to give a little bit more room there. So very simple idea, and I'm sure you can understand the concept of it. As I said, it's the lightweight mesh in navy blue. So that's the walk assist. Thanks, Jude. So then we'll look at the manual transfer sling. So often in an emergency, if someone's fallen down, you can't get a hoist in, then we've got a manual product used for travel, things like that. But the little manual transfer sling looks like this. So it's the sling shape without tapes, made in polyester. It does have stiffeners or bones down the back on either side for support, little waist support there, and then positioning handles all the way round. So depending on the weight and depending on how many carers are required, so then they can use the handles to lift. Usually put on the floor. We're struggling today, and I do apologise. We're in a temporary room, which hopefully in the next few weeks we'll be moving into a new studio, but we are going to cope as best we can. I'm just going to put it on. It's very difficult to explain without a proper person, but it applies like a sling. We'll do it in the chair. You can take that side, Jude. And it can just be scissored underneath. There is a little pocket, which I'll show you when I lift it up. The leg sections come through as a sling would. So through, there is a waist support. We just couldn't put that on, and that helps to keep it in, to position it. And then there's a little zip section. So connect the multi strap and zip the legs together. Got that there. So we've got it on, quite straightforward. And then, as I said, there's positioning handles all the way around. Depending on how many carers you've got, you may have someone holding at the back or at the side. This one, of course, is very light, so I'm going to use those there and just to lift. So then we can get this person to either a changing table or somewhere where you can apply a sling, but very straightforward. Just turn it round. We can see from the back, so full back support there, the little pocket there, which is there to help support and prevent slipping through. We have done them without the pocket. Has been requested before for emergency rectal medication. So certainly if the pocket's not required, then we can take that out. So just come round. Its standard is in polyester. We have done it in the Superfine Plus fabric, which is more of a spacer fabric. So if that's requested, then it's possible to have it in that fabric. But quite simple, straightforward, used for, as I said, emergency use, travel, things like that. So that is the manual transfer. Sizing is always a bit tricky with this one. They do tend to come up very, very small. So if a full head support is required, just check the height and then measure your youngster's top of head to base, just to make sure you've got enough height from the head support section. So it really is quite a short or skimpy style sling. So hopefully that's straightforward. So that's the manual transfer. So I'm just going to take this little one over here. And also another product that's a combined manual hoistable product is our travel light. So the travel light surprisingly looks like this. It comes in a bag. It's a sling in a bag. So very popular for travel. It's lightweight. It's got straps on, so you can hook it on your shoulders or on a wheelchair. And if hoisting or manual transfer is required, then the sling just unfolds out of the bag. The bag section creates the head support. Tuck the tapes away and it looks like a sling. So we've got a sling shape, applies like a sling, and then as you draw it up, the draw sides create the loops to attach to the hoist or the handles to manually lift. I think we have got a little presentation video that I can show you to give you a better idea. So if you can play that, please, Alice. So you can see here, we'll just show you. I think this is the hoistable one. So it comes in a bag, as we explained. Very simple to unfold. And then fold back up. So, you can use this for days out, travel, any emergency situation. So quite a useful little sling. It's made in the lightweight superfine fabric, so it's very light and fine. So it could also be used, it's a mesh fabric, so it could be used for bathing. The superfine fabric has inherent Coolmax in, which helps to wick away moisture. So useful in that respect. It has got some give, some two-way stretch, so it hugs the body nicely and will sort of hug the contours and the shape. So quite a nice different product. And again, look at the website, it's got all the information that you require. So that is the travel light. So moving on now to harnesses. And harnesses we know are widely used to help promote standing. They're also used to reduce handling. Silvalea has several versions. Certainly I've got a couple of examples today, just so that we can explain, but there are more. But the first one is our, I think it's the Rachel. The Rachel harness is the most popular. It's a little jacket harness that you put on like a jacket, zip it up, and then you've got the groin section that comes through to clip in. I've got it on this dummy just to show you. The tapes do detach. So initially it was developed and designed for an able-bodied toddler whose mum had limited strength to lift. So dad would put the harness on, and then when mum needed to lift the youngster into his buggy or high chair, she was able to clip on tapes, and then the hoist would just gently lift him into the high chair or the buggy. So it worked really well. So then we introduced it as an option for other things. And it's widely used in schools. It helps to take away the handling. It also is used in this type of situation if the tapes are attached to the hoist, then it will help someone to sit up, so all their energy is not taken up with trying to sit up because the hoist is supporting them with this little jacket. So really quite a useful respect. So if they're doing activities, then they're supported by the jacket, and then they can carry out their activities rather than trying to control their movement. So useful in that respect. To help stand, walking. You know, some harnesses, you don't need to be weight bearing as long as you can feel toes, because it helps with well-being, muscle strength, things like that, inclusion. So, you know, the harnesses are really popular for therapy as well.
Good for walking frames.
Yeah, also for what, you know, transfer to walking frames. We've got this, as I said, these all unclip. So once you're transferred, you can unclip it. So then we can take the hoist away. But I've got another take on here, which I want to explain. If we just take up the slack a little bit, I'm just going to effectively stand this dummy here. I'm just going to turn him around, because the sling comes with these tapes here. So these are hip tapes, and all the tapes are on adjustable sliders. And this, if it's adjusted and hooked up, will help to get into a prone position. So we can see effectively what that is designed for. So if it's at the right setting, then you can get into the prone for going onto a wedge, things like that. Quite often they are detached and not used. So I know that because we don't ever see any with hip tapes come back or, you know, talked about. So the hip tapes probably just get taken off and they're not used. But that is the whole reason they're there. And if you see there's got a loop at the hip, it's for that purpose. Little clips here. So if we need to transfer for toileting, you know, if you've got a weight bearing youngster who can then stand, then they can take the groin section down and take it back for a toileting transfer. Little zip to help put it on. And a new development, if you're used to this, is that there is a shoulder opening. So you actually apply it like a tabard. So that was changed recently so that if you had got someone with contracted arms, it then was difficult to get a waistcoat type thing on. So they have developed this to have plunk click at the shoulder. Sizing is tricky. And I know that because of all the queries, because it's got to fit, you know, reasonably well. If it's too big, it's going to hang. But we have got a basic sizing guide on the website, and I would recommend that if the client doesn't fit exactly into the sizing on that chart, then you may need to have it custom made. But if you have any queries, please contact us and we will talk you through it, because you know you can't really allow for growth with this one, because you will be it'll be too big and they'll be swimming in it. It won't be supportive. So I do think sizing is really important with that style. It's a mesh. We know it's being transferred to into swimming pools. So that type of situation, hydro, so that's fine. I'm just trying to think if there's been used in any other situation, but it can be made in adult sizes as well. You need to, of course, make sure you've got enough height with the hoist. But you know, harnesses can go on mobiles if they go high enough, or overhead. So certainly that the options there. The sliders are adjustable, so you can get more length and shorten it if necessary. So that's the Rachel harness. The other little harness we've got is the Jolly Jumper here.
Mandy, just very quickly,
Yeah.
we've got a question on the purpose of the metal D-rings.
Okay, yeah, no, good point.
Thank you.
So let me just explain the D-ring. So this is the tape. It has got a D-ring. We're trying to get rid of these D-rings, so you might start to see them something else on them, a little plastic strip. Basically, a D-ring is there so that if we do extend this tape fully, because we need the extra length, we don't lose that loop. So it's very difficult to get that loop open. So we have a little D-ring to keep the loop. But once you've got your setting, just push the D-ring out the way. If it does get hooked up, it's fine. It's got strength that will, if it goes on the spreader bar and people hook it up, then that's absolutely fine. But generally, it's just to push it down out of the way and then create your loop there. But as I said, we are looking to introduce a less clunky type D-ring, and it's a little plastic bar. So some slings will start to come out with that type of strip rather than the D-ring, so that it is less clunky for youngsters particularly. So hopefully that answers that question. So going back to the Jolly Jumper, this is I think a really good supportive harness. It's got a really big back, long back section with full bones in the back. So it will give someone a little bit more support. So the Rachel harness, you know, you've probably got to have some head control, otherwise you'd be lolling about. However, we have done little strips that go over the tapes if that is the problem. The harness is good. It suits the situation, but if you're worried about protecting them with the straps, then we can cover them. So they would, yes, they would look like this. Show you. This is a little plastic toweling sleeve that would go over. It would just Velcro around, so that's an option. But with this one, there's a few more benefits to this one because of the back and head support. You've also not got tapes that are coming in front of the face like here. So that is a really good plus. Lots of freedom. So it's a really good shape, particularly for family inclusion, activities. So certainly it's a very good supportive sling. A bit more fiddly to put on because you've got to roll. So roll and roll, to be honest, to get the harness on. I think we've got a little slideshow, which I think, Alice, if you would kindly just play, and then I can talk through it and show you what I'm referring to there. It's easier than me trying to explain it holding this up. So applied on the bed, of course, is the best way. We'll just show this little clip because I think it shows off the harness very well. So as you can see, lots of ways of using it. A bit like a baby bouncer in if you can picture that. So the straps come over the shoulders. There's plenty of room for growth with this one, which is another plus. And gives good upper body support by those shoulder straps. So the section comes through the groin, connects to the waist section, and then you fix it at the back. So it wraps around to give good hip stability. So it's as clear as it can be. Adjustable tapes that go over the shoulders. And then slides through there, you can see that the adjustment there for the positioning. Added a little groin section and then it clipped around the back. So because of the good head support, you can do floor pickups. Certainly anything with a good head support. Do you want to come back, please, Alice? Then floor pickups are possible. I think if you're picking up from the floor and you haven't got a good head support, you've got to be very, very careful. But, you know, it's all down to individual risk assessments. Everything that you do really needs to be risk assessed because of each individual scenario. But yes, this one, because of that, really good support there. But if we just going to take this, you can see the back here. This is the back section. So these effectively feed through the little handle. This is why it's easier to do it on the bed, and then clip round the back, adjusted, which give a hold as firm as possible, gives that really good hip stability, and then you've got little handles created.
And also the design, the top and it.
So this one, I'll just take it a little bit so we can see. We get the idea that it's very open and very free here. This one actually has got the little slider. So, you know, we talked just earlier about the metal D-ring. This has got the little plastic slider. Hopefully you can see that. That just gets pushed out the way there. So yeah, great little harness. We call it the Jolly Jumper. So just to give it an idea, it's like the baby bouncer. So yeah, the Jolly Jumper. Again, think about your spreader bar. This one, as James explained, is an adult one, but there's lots of adjustment here, and then you can shorten the tapes if you need to. So those are the harnesses. I'm not sure, Alice, if there's any questions we haven't answered that you can relay.
Yeah, we've just got a couple. So can the child be lifted off the ground with this sling?
Yeah, yes. I mean, certainly harnesses are really good. So to encourage natural patterns, particularly the Rachel harness. So if you're trying to encourage them to, you know, kneel, half kneeling, standing, you know, the harness can do that gradually. So if it's applied on the floor and then you start to take up the slack from the hoist and do, you know, the natural rolling, natural patterns of getting up, then harnesses are brilliant for that, particularly the Rachel one. So yes, so certainly they can be used from the floor. Any more?
Yeah, the other query is in relation to the plastic or the replacement for the metal D-rings. These obviously aren't weight bearing
No,
because, but
no,
they
the
won't
plastic
allow
ones,
you to
no.
connect them to the hoist anyway. There isn't an option to. Um, so James just wanted to know why it is still there.
It's there because, as I said, if you extend that tape fully, it's hard to get the loop open. So we put either the D-ring or the plastic bar in just to keep that loop open, because the slider will just extend, and then it's really difficult to open it up and then prise it open. So that's why it's there.
That's everything. Thank you,
Thank
Mandy.
you. Okay, right. Let me just then just take this one down, because we've got a couple of slings now to show you. Popular slings for challenging situations, used often for, as you know, in schools for children. I'm just going to move this out the way and bring in the easy access. I think we'll just move this, Jude, if we can. We are, as I said earlier, we are moving into a bigger studio, and we will have lots more room. It won't look so clumsy. So apologies for that. So the easy access. So let's just talk about this. This is quite a structured sling. You can just hold that, Jude, please. It has got foam throughout, so it's quite firm. It's going to give a lot of support. Full head support here, counterbalance strap here, and then this wraps around the trunk. So a little bit of a fiddle, but a really good option for active users, somebody that's got lots of movement, good access for hygiene transfers. Quite straightforward to put on. If I just put it on Judith, who's kindly agreed to model this. We're not getting it too far down, so it's going to waist level, so we haven't got to struggle to get it too far. And because it's firm, then it is quite easy to shimmy down into the chair. And also it's made of a structured polyester that's got a natural sheen. So that's really good. It will help to get it into tighter chairs. So Jude's just doing the chest strap. So we've got a chest or thoracic support here that's wrapping around. It's going to wrap around the body and then cross over into the loops on the opposite side. Leg sections also have foam in, so they again are easier to get in. You've got a tight situation, and then we cross them over. So we've got legs, we've got thoracic section, and we've got a counterbalance. So 3 tapes to factor in there. But we'll just hook it up slowly, and we'll go yellow.
Yeah.
Yellow on the leg. It's all color coded to help with positioning there, which, you know, you have to then determine once you're doing your risk assessment initially to work out the most appropriate. But there's lots of options here. We know with Judith that we've got it on the yellow leg and then the red thoracic section. But the counterbalance needs to go on last. So if we've got a 2-point spreader bar like this one, then ensure that it goes on last, because it will then, if someone has got movement, it will let them move. It will flow then on top. So it's not going to restrict the movement, but it will just control it. So I'll just slowly take up the slack here. The counterbalance straps have got adjustment with the slider buckle here, so that we can extend it or tighten it accordingly. So it's really important we just check we're not going to. So it's going to fit firmly. We're looking at a situation where someone is very, very active, very wriggly. Oh, Julie's off. She's doing her active wriggly bit already. So we can picture that, you know, if you've got an extender, then this counterbalance actually flows through, is on top, and allows the movement that will keep someone contained safely for your transfer. It has got a good aperture there for hygiene transfers, so that is possible. It wraps around, as I said, it's going to fit very firmly. So we're looking at someone with really poor tone. So if Jude can you relax totally? Can you try and flop through?
Yeah,
Bring your knees up. No, she's very contained within it.
very contained.
Because it is firm. So you would need to think about whether if someone doesn't like being restricted, then it might be too fitted. The crossover in the front, should you allow for you to get your fingers in? So, you know, it is going to give a lot of support for those that have no upper body tone. So you need to think about whether it's going to be too tight. Certainly with young ladies, it will push the bust up. It has got a free area here, so it's quite good if someone's peg fed rather than having the waist support. But it might bite in. So if you've got someone very shapely, it might bite in. So you've got to think about that, weigh it up as to whether it's going to be suitable. But I think we provide this for lots of slim athetoid CP type scenarios because it will give that extra support. You can adjust the tapes here to recline slightly. So a good option for you active wrigglers. This is we call it the easy access. It's part of the Continental range. So, you know, you'll have to just check on the website for that one. It ranges in size. We go down to extra small. I think we could probably even go smaller to extra large. However, I think when you get larger, you need to think about the proportions of the body so that if someone is, as I said, shapely, then be mindful that it will fit snug. I did see a couple of questions there, Alice. I don't know whether I've answered them or not.
I've just answered a couple, but we've got one question saying, do they need sitting balance for this? I explained that this is for poor and reduced tone. So they've also said, is there a risk of falling through?
Not if it's fitted properly. So, you know, need to make sure that the fitting is correct. Judith tried to slip through. This was a really good fit on her. But if it's loose, then you're not either, you know, there is a potential to slip through. So you need to be really careful in the sizing. But no, generally, if it's the right size, then there shouldn't be any risk of falling through.
And then the other query we have is Leslie has a child who holds sling straps and thrusts backwards. Is this possible in this sling?
They can hold the straps. You know, that's fine. They can hold the leg straps. If they thrust back, the counterbalance will allow that movement. If you want to restrict that, then we need to look at a different style, which I'll show you. We have got another option, but certainly, you know, this will allow the movement.
That's everything. Thanks. Oh, that's everything.
Okay. Excellent. Okay. Thank you. Thanks, Jude. But we'll look at the most popular sling that we are asked for to be left in place. So leaving a sling in place really has to be thought about very carefully. Everything needs to be considered and weighed up by everyone involved. All the healthcare professionals need to make that decision and establish whether it's suitable to be left in. But certainly for children, this deluxe shape, the In Situ Deluxe, is our most popular in the fine, lightweight, superfine fabric because it's lightweight, breathable, and it has got the stretch. It's got the Coolmax in, which helps with wicking away moisture. This one has got built-in head support. And as I said, it's the most popular. It is divided leg, so we can put it on in a chair, so it can go down in a chair. The most important thing is to get the sling down as far as possible, ensuring that the leg sections come around to support the femurs fully. If it's positioned too far back and the leg sections are mid-thigh, could bite in, won't give enough support. Legs have a parasilk covering to help with slidey fabric, got to glide the leg sections in. and then we've got a red modesty that connects the legs together, and then you feed the tape from the outside through. So that is the leg section. But that it's important, even if you're putting it on the bed, to make sure that you've got the lower half in place. The sling comes around, you've got the bottom support and the legs fully supported. Don't worry about the top section initially. This will sort itself out when we hoist. So I'll just hook this up. Go on the green. So I'll just help Judith here. Green leg. Sorry, just middle there. Green shoulder there. Do it too quick. I have got an additional tape on this one, which we'll explain in a moment, but I'll just tuck that in. So this, because it's got the superfine fabric, which has got the slight elastication, it will hug contours really nicely. So it does support very smoothly around the body. There's no handles on the slings that are going to be left in for longer periods because we don't want to create any more pressure. The bones in the back section here, they can be removed. Often they are removed because people prefer not to have them. They could be too restricted if you can put your head back. So it's fine if they're taken out because we've got head support tapes here that can be adjusted to give the right positioning for the head support there. Good support to the femurs there. There is a little bit of access for toileting if needed. So if it is required, then we can transfer to the toilet. But the deluxe leg, it wraps around each femur and gives a more control than a standard general purpose shape. So if Jude was a bit wriggly, you've got individual control from those leg paddles. So quite a good shape. And if you've got differential because of windswept hips, then you've got more adjustment with a deluxe leg sling. But on this one, I've added hip tape. So hip tapes are additional, but they are really helpful if you're trying to lift the hip area here. So they just lift slightly and they will help with weight distribution. So if you've got a situation whereby you've got someone sinking and they need that little bit more support, it lifts the hip, distributes the weight, and it will take pressure from behind the knee. Ideal for anyone that's got arthritis or pain in the hip area. So just to lift. And they are on the slider, as we've talked. They would be, I'd have to lower Judith down just to get it on in the right tension, but you just adjust it to the right tension with the slider. And you need to get it to pick up the same time as the leg, so simultaneous with the leg. If it's too loose, it won't do anything and it will not give any support. If it's too tight, it's going to force the hips up first. So just adjust. But quite good for if you've got asymmetrical shapes, and you can adjust the tapes asymmetrically so that you can try and get a better position for that transfer. If you've got someone trying to hold somebody in, you just need to adjust. Slings are very versatile, and that can be achieved quite easily, even if you've got to hook up one side slightly shorter. So you would do that with your risk assessment. But certainly these slings they get very useful. There's always going to be people that prefer to take the slings out. You've got to weigh it up. It's a balanced decision as to whether it's easier for all carers to leave the sling in. Think about shearing, getting in and out, but you still got to weigh up any pressure. things that can cause that sort of problem. Fabric choices, sling design. We have got options for you, but certainly you've got to think about all that. But then, we can help. But ultimately, it is, it's a balanced decision by everybody involved.
We'll talk about the cushions, Andy. Can we have a chest support?
We can add things to it. Certainly, if you need chest support to keep it in place. The other thing that we can add is a neck roll. Neck rolls are quite nice just to support the neck in the neck, rather than a head support forcing the head forward. So that's quite a nice addition. It can be moved to the side if you've got someone leaning, and they just clip through, hook through onto the shoulder tape here. So we just slide that behind Jim's neck. It might give more comfort to that neck area there, and then just clip it onto there. So things we can add on are your hip tapes, your waist or chest support, depending on where the position is required, and a neck roll. These slings can also come without head support if you don't need it. You just need to ask. And there are other fabrics as well, so other in situ fabrics, which we will cover in an in situ session. But the other option is your Superfine Plus, which is the spacer mesh fabric, which I'm sure most people know because it's very well known within the industry. But as I said, this is one of our most popular for in situ use. If someone's leaving it on, just unclip it a minute. And you're worried about the leg sections, they can actually be taken and just gently folded to the sides. So we put them to the sides effectively, then there's hardly any sling underneath. Certainly if you've got someone that's padded, then we don't need to worry about that. But if it's being used for toileting, then certainly you can take the leg sections to the sides if more comfortable. So that is our in situ deluxe. Again, there's lots of information on the website that will help you further. So are we okay, Alice? Have you got any other questions?
No, it's okay.
So this fabric is, because it's lightweight, often children will have very fitted seating. So it's the lightest one that we can supply. And it is very fine, as I said, so that's why it is so popular. The single layer has a weight limit of 10 stone, which is 64 kilograms. If you've got someone of a higher weight, then we would offer a double layer. So it'd be 2 layers. And that's so that it's got less stretch. If you've got a heavier weight, it stretches and stretches, whereby if we put a double layer in, it stabilizes it more. So certainly anyone over 10 stone will have a double layer of this one. It's a mesh. Often people will have 2 because the mesh can be used for bathing. So same style, easier for carers to have something similar. So yes, the mesh fabric will allow water to sort of fall through it there. So that is the in situ deluxe. And I think we're right for time, hopefully. The final sling is our Tinkham. So the Tinkham is the ultimate, really. We were faced a few years ago with a very challenging situation whereby somebody escaped out of everything. So had lots of movement, very active. So we came up with this design, which looks to be a little bit of a monster here, but basically it wraps around the body. So you wear it. And the idea was trying to break up the extension. So by features on the sling that would help to protract that person by bringing the head forward, protracting the shoulders and keeping them locked in a position that prevented them from this and escaping out. So, it looks like there's a lot going on, but certainly by doing it slowly, then we can gradually fit it. It's better fitted on the bed. think we have the first thing is to make sure you get the waist support in position. I think, Alice, have you got a little video that we can show of this one, because it is complicated and it is easier to see from the little clip of it being fitted on a bed. So it's can be applied in a chair, of course, because it's a divided leg section, but by inserting it on the bed with someone on their side, it's much easier. And as I said, you need to get the sling in position, wrap it over to make sure you've got the waist support. It's a good indication of its positioning there. So get the waist support in and then roll the youngster back to fit the waist support. So a little soft clunk click. The leg sections have got Parasilk on, which will, as before, help with the easy glide of inserting. So here they're just making sure that it's centrally positioned so that it's in the right place to start with, which always helps. But that is in position at the waist. Leg sections are applied as they would be with a sling. This particular sling has the silver safety slot tapes, which work exactly the same as loops, but they're an innovative type of slot. And I'll explain that. But the leg sections come through, and then they've got two modesty straps effectively. Those red straps, you've got one on the leg section and one at the top. So we're trying to keep the legs together. Trying every effort to keep those legs together. So building it, I tend to build it from the legs up. So in a situation where you've got someone quite active, you need to keep the legs short. But go on a shorter leg. Then there's two hip tapes. The hip tapes are on slider adjusters, and they would then need to be adjusted during your initial risk assessment and positioning, but they hook on. And then you've got the shoulder tape, and finally a head support tape. So lots going on there, but we have solved a lot of very challenging situations in the past all over the world using this particular style. We had a scenario in New Zealand where they had to transfer someone in a very specific position, otherwise they would the airways would be affected. So this really helped by getting them into this specific position and preventing them from throwing their head back. And then gradually, when you take up the slack, check it all. Check you've got all the tapes on, hip tapes are positioned correctly. And then we can see how the sling fits. So I think if we can come back to me, please, Alice, I'm just going to put this on Judith so we can just see it again, step by step, in a chair dough. So we've applied it, we've got the waist support fitted. The leg sections come around, and then as I said before, we've got two modesty straps. We've got the leg one there and then the one at the top. So feed those both through. So we've got that. We fitted it here. We've got the two hip tapes, and it's advisable to have the hip tape towards the knee shorter, so you're keeping that leg flexed. So if it's too long, it will still dangle, but keeping the hips flexed will help to prevent that. So adjust that. So let's go, just build it slowly. We'll go from the legs. So we're going on the green leg, two hip tapes, the shoulder tape. So this is going to wrap around the shoulders and help protect. I'm not going to attach the head support just yet. Just going to take it up so slowly. And we know it's tricky. You know, you've got a wriggler, someone active, you're probably going to have a couple of carers just to get used to this and to fit it. But checking, we've got the legs, 2 hips and the shoulder at the moment. I'm just going to take up the slack. I haven't got your head support on yet, Jude. So we've bucketed it slightly. So thinking about keeping the hips flexed and the head support tapes, you know, we can lock that head really tightly forward if needed, but we've got several options. I'm just going to put it on the yellow for the moment. And the head has got a little pocket here. So if Judith tries to escape out the side here, this side, then we can see. So it can be active, regular twists, you know, you've got lots of support from that sling. So if we can picture this situation, then certainly we can help with this style. So that's the Tinkham. Again, we do standard sizes. There is lots of information on the website and the videos which will help remind you of the session of the sling. But there's a soft padded neck roll in the neck. That will, when you start to fit it, probably be lower down the neck to start with, but certainly it will fit into position once you take up the slack and the body sort of positions itself into the fabric there. So I will just check with Alice to see if there's any questions on that one.
No questions, Mandy.
Okay, so that's in a nutshell, basically, some of our most popular paediatric slings. So I hope it's been helpful. Please look at the website. Certainly we can help you with any question. And Alice is available to help with assessments. So she can link up and help you if you're not sure. We can demonstrate things via this system too. So certainly, you know, we're here to help you. But please use us. If we can provide any extra information, we certainly will. But thank you very much for your time. Thanks to Alice for all the admin and helping with the system here, and for James and for Judith for helping me with being my model. So thank you, everybody, and hope to see you again soon.
Thank you for a great session, Mandy and Judith.